Hello everyone, I have a wonderful, delighted to share with you her story, her experience. You are now post-op day number 8 from your surgery, removal of implants that you had for a total of 14 years. Now tell us how you feel now.
Honestly, I feel incredible. I came in today thinking, all right, it is 8 days post-op and I have had a C-section and I had implants put in 14 years ago, and I have never had a recovery go so smooth, had so much energy, felt so good, not fatigued, and no pain.
Yeah, no, this is truly like incredible. Now you told me, and what's interesting is you have so many followers. They were telling me your patient's walking 6 miles a day, and I use the word walking gently. Let me ask you a question. Everyone gives the binder a bad name. How is the binder for you?
The binder is phenomenal. It helps keep everything tight, and I think it helps with the pain of everything just not hanging out. And it also is going to make your skin and everything go back together better than if it was just there hanging. It's kind of like those things they put around your waist to make your stomach become tighter. It's because it's holding the muscles and everything in together so that your skin can bounce back and the elasticity can go back to where it belongs.
Exactly. Very well said. Very nicely said. Something that you can say that other patients can relate to. Now, you come from a family of anesthesiologists, CRNAs. Your dad's an anesthesiologist. How was your anesthesia experience?
Amazing. I loved that when I walked in the morning, I knew exactly who my nurse was going to be. She was with me every step of the way. We even got to know each other a little bit. I loved that I knew the anesthesiologist and that he was going to be there every step of the way. Not I was going to wake up and have a different guy named Fred and whoever. And I loved that I also had my CRNA, who was absolutely not only beautiful, but she was very sweet and loving, and I got to wake up with her as well. So you get to know these people before surgery, and after you wake up and you're in the recovering room, you also have the same people who know how you felt before surgery. So it helps keep the process that much better and makes you feel that much more safe.
Sure. Again, I have to say you followed my instructions. Yes, you were walking 6 miles, but you told me something very nice. The treadmill certainly can cause vibrations, but not as much as the car. And you were very cautious all along the way, using basically your sixth sense to guide you, such that you were always cautious and moving along exactly how I had instructed. Now, what have you noticed, like the biggest changes pre and post-op as far as BIS symptoms?
I have noticed my sleep has improved, my insomnia, my fatigue, and chronic, even inflammation of my stomach. And also I have a picture of my skin. It was kind of more dull, and even the day that I got out of surgery, my husband, who has been a supporter of this, he's like, Michelle, I've never seen your skin look so good. I feel like now it's glowing. So the two things that I'd walk away from that have been the best so far have literally probably been the energy, the brain fog, man, just like being able to concentrate, feeling better, not having so many anxious, rushing thoughts going through my mind, and those are the things.
Sure, very important. The dryness of the skin, the eyes, certainly these are the two biggest things that we know that the patients have said the skin is oily again. Now, thanks very much for sharing. Now, you're so, I have to say, you know, all my patients have, we all, including myself, we have something unique to offer. You have that positive energy, that positive vibe that you have. I like that, admire that. You know, you come in with a positive attitude. You were well read. You knew exactly what you were signing up for. You were ready for it. I like that. So what I'm going to do is, like 2 weeks out or so, either on a Monday or a Friday, I'm actually going to do a Facebook Live with you, just so that we can share from your experience and see how and what your experience was. You have a lot of followers, so that we can see how and what your journey was, so we can learn from you and tell the many others, look, you did not need a drain, clearly, and you did not need a lift, clearly, for someone young and healthy and energetic who's very much concerned about her looks. And these are the two things that can be done safely, absolutely, such that you get the best bounce back, minus the risk of the lift, minus the risk of the drains, and the twilight anesthesia, the minimal pain that you said that you had, and again, every person being different, such that you get the best bounce back from what is an involved surgery, but a surgery that, if you follow through, most of the patients do very well.
And one more thing I want to add is there's nothing wrong with following your pain medication and setting timers for every 3 hours, because you are better off not putting your body into stress, highering your blood pressure because of the pain, and it's going to make your butt stay in bed and on the couch even longer. The more you can get your blood flowing and going to the part that just had surgery or incisions, the better your body is going to be able to have the blood attack that area and make you recover and heal even more. So I am telling you religiously, since the second I got out of surgery on Thursday at 10 o'clock in the morning, every 3 hours I followed a schedule with my pain meds and didn't get off them until Sunday afternoon. Thursday, Friday, Saturday, and that helped me get up and walk circles around my house, 6 miles with my arms like this. It helped me be able to get up and out of the couch and out of bed without having to say I'm in too much pain, I just have to lay here all day long. Because if you let the rest of your body get stiff, it's going to attack the area that's trying to heal as well and make it stiff. So follow the doctor's orders, use the pain meds. If you're in pain, something is wrong because you shouldn't be.
No, thanks. Your gut instinct is never wrong. And so basically you follow your heart and your gut and you'll never be wrong. Thank you again. Look forward to talking to you again in a couple of weeks. All the very best. Thanks for sharing your journey.
Of course. Thank you so much.
Bye-bye.